Ruben and Phil and Stan gave us a great overview of the current status of the dairy industry here in Michigan, not only here in Michigan, but all over the United States. And they highlighted one of the major challenges for dairy farmers, and that is labor management. In this talk, I'm going to talk about a special issue that we have, a very special problem that we have in the dairy industry, and that's mastitis. And the way we could train our employees to have less mastitis in our farms. So before I continue, I know Ron already defined the disease, but mastitis is the inflammation of the mammary gland of the cows, that is the udder, and it's often caused by a bacteria. And what's really important about this disease is that it's the most costly disease for the dairy industry, not only here in the US, but worldwide. Another important thing about mastitis is that it's the main cause of antimicrobial use in dairy cattle, and therefore is highly associated with drug residues, not only in milk, but also in meat. And it's also important because it causes a lot of economic losses to the plants, for example, because they have reduced yield of products such as cheese or yogurt. To the farmers, because it reduces the productivity of the cows. And to the retailers, because it reduces the shelf life of the milk once the milk is at the grocery stores. Because of the importance of mastitis to the dairy industry, ideally every farm should have a mastitis prevention and treatment program in place, because it's obviously essential for food safety and the quality of dairy products that we deliver to consumers, and also because it's a disease and it's important for animal health and well-being, and of course because of the cost that I just described about mastitis. It is important for the economic success of the producers. We have several tools when we are designing a mastitis prevention and treatment program in a farm. We have several tools available for the producers. Obviously, we have the antibiotics that we use to treat cows, but those are not the main tools that we have to prevent mastitis. There are several other tools that we could use in order to prevent mastitis. Some are designed to reduce the amount of bacteria that they have on the udder. Some other ones, such as the vaccines, are designed to make the cows more resistant to mastitis. We have several options on how to manage our cattle in the stalls or through nutritional interventions to improve mastitis resistance. We also have developed several new methods and new options for milking machine equipment that help us monitor the way we milk our cows in a better way. And we have several options to have better diagnostics of the disease. And also we have several programs available to the producers to train their employees and to train themselves in mastitis related knowledge. But we have an issue. Sometimes the producers, they have these many tools available, but they don't know how to assemble a mastitis prevention program, and that's very difficult, especially in the US because of the diversity of our dairy industry. We have several herd sizes. We have small, medium, and large herds. We have different types of housing, and those are obviously related to the geographical location, the type of place where the cows live, if those cows are outside grazing or if they are in a conventional or organic farm. And obviously, as Phil and Ruben described, there are several issues with labor that make the farms very different from one another, even if they are neighbors. Previous attempts to design mastitis prevention programs used to fail, especially in the 1980s, 1990s, and early 2000s, because they tried to have one single program for all the farms. And as you can obviously see from what we have heard, one size does not fit all. First of all, because the diversity of the US dairy industry, but also because it does not allow you to identify all the management priorities for each individual farm. And obviously, those programs are just one way, so they are not able to evaluate the outcomes of the interventions. And they do not evaluate the lack of effective communications between producers and higher labor. So seeing all these challenges in the design of mastitis treatment and prevention programs in those farms, we developed a project that we have called Quality Milk Alliance, together with persons here, researchers here at Michigan State University, from the College of Veterinary Medicine, from MSU Extension, from the Julian Samora Research Institute, and colleagues at University of Pennsylvania and Florida A&M Institute. And the project is an integrated extension and education program to reduce mastitis and antimicrobial use. And one of the main objectives is to develop and evaluate a farm evaluation and monitoring program that we call QMA as a tool to reduce mastitis and antibiotic use on dairy farms. This QMA has 5 key components. 4 of them have been already approached by previous mastitis prevention programs, and those include milk proficiency. There's nothing else that evaluating the way we milk the cows. Milking system is to evaluate the machines that we use to harvest the milk. Cow environment is to evaluate where the cows live, and the way the farmers do monitor and treat the cows that are infected with mastitis. But what's really unique of our new approach is that for the first time we are evaluating the farm management culture. And because it was so unique, we didn't know really what we were pretty much doing at the beginning. So we first sent a survey to dairy farmers in the 3 different states, Michigan, Pennsylvania, and Florida. And from those farmers, we received back 628 responses, that equal to about 41% of the surveys that we sent. This was complemented by focus groups, as Ruben described a little bit in his talk. Those focus groups were with dairy owners, managers, and employees. Obviously, in the survey, we included questions about the 5 key components of the QMA and of any risk evaluation program for mastitis. But I'm going to talk only about the farm management culture findings from the survey and from the focus groups. From the survey, and this is from the 628 herds that reported back to us, we found some interesting findings. First of all, that the higher the number of cows that they were milking, the more likely they were to have a poor milk quality. The second thing is that poorer milk quality was associated with the presence of non-family employees. That's one good finding. Second important finding is that the farmers that recognize that employees play an important role in mastitis management, and those farmers that do train employees in mastitis protocols had a better milk quality than those farmers that did not. This table, I summarized some of the findings from the focus groups, and we focus on technical knowledge because the more the farmer and the more the worker knows about mastitis, the more possibilities that they have to treat adequately the disease. And it was very interesting to find out that regarding training, the way farmers do train the workers is very diverse, obviously reflecting the diversity of the dairy industry in the 3 states. But most of the workers were training on the job by other co-workers. Very few had formal milking training schools. And as Ruben pointed out, workers usually learn what to do through their work experiences. And what's really interesting to find out, and Phil already reported a bit on this, is that Latino workers, they express the interest in a need for more training for doing their job. A second interesting finding from the focus groups is the source of information where the milkers, especially the milkers, got the information about how to treat mastitis and how to manage mastitis from. Most of them got the source of information from co-workers with more experience, so senior to them. This is very interesting. Some of them got the information from pharmaceutical sales representatives, and that might lead to a few other things in interpretations. Very few of them got the information about how to treat mastitis and how to manage mastitis from veterinarians. And what's really interesting is this quote from one of the workers that we interview is that the cows, when they have mastitis, they just need to be treated with the treatment or the liquid, but they weren't sure of what they were using to treat the cows or why they were using. And this is a picture of a Latino worker treating a cow for mastitis with the liquid or the yellow tube. They don't know what they were doing, really. When you ask who usually train new milkers, you see a different range of responses, actually matching one of the tables that Phil showed before. The Anglo workers reported being trained by the managers and other milkers, the majority of cases, but if you look at the Latino workers, the majority of Latino workers got trained by other milkers, and very few got trained by managers or owners. So based on those findings from the focus groups and the surveys, we wanted to develop a dairy employee education program that's going to be a part of the intervention phase of the Quality Milk Alliance project. Our objective is to develop a dairy employee education that builds milk quality teams that include owners, managers, employees, and veterinarians, and that is based on mastitis prevention and milk quality protocols that can be followed by the milkers, can be followed by the employers, and can be followed by the employees. And it would focus on not only on the when, and how to treat mastitis and to prevent mastitis, but why we do the things that we include in that protocol. And actually, we want to improve the technical knowledge of mastitis, not only of the managers and owners, but actually of the employees. And we want to include the veterinarians in the training of those workers, because they are the ones that have that are the ideal source of knowledge. This is a picture that can be taken now or 50 years ago. This is the model of the veterinary extension, where the veterinarian, which in this case is Dr. Ron Erskine, another veterinarian who is the veterinarian of that particular farm, who goes to the farm every week, and this is the owner of the farm. They sit down and discuss the challenges that they have on managing mastitis. And again, as I said, this picture could be taken 20, 30 years ago, that would be the same picture. However, we have new partners on business, and those are the guys, los muchachos, that work with us, milking the cows. And guess who's missing in this picture? It's missing the owner and her veterinarian. They are never around. So the only person that's around there is el gran jefe pluma blanca, as I call Ron sometimes. He goes only once or twice a year. He gives his talk in broken Spanish sometimes, just like my broken English here. And he comes back maybe 6 months after or 1 year after and asks them, hey, how did you do? What did you learn? His talk only lasted for about 15 minutes, so it is very unlikely that they're gonna learn anything from it, or at least remember anything from it. So what now we want is to engage the veterinarian, who's the one who goes there every week to check the cows, to start training the employees. So we want the veterinarians to become the new science teacher for on-farm classes. And we have developed a special place to be set in each farm that we call it La Esquina de la Calidad de Leche, or the milk quality corner, where we're going to place information for the milkers and the workers to learn about mastitis, to get trained, to increase that technical knowledge that they probably already have, but they don't really know how to use it. And actually, by giving a special place at the farm, we are engaging in education all the time. We have provided vets with especially targeted lessons for the milkers. So if we identify a specific problem in the farms, we can target those lessons for that specific farm, and then we promote the discussion between the milkers and the veterinarians after they have learned the lesson. So in this way, we're engaging the veterinarians and the employees in communication, and that way we wish to improve technical knowledge, and not only in the owners but also in the employees. So our objective with the Quality Milk Alliance is to engage all farm personnel into the milk quality program, which will improve management practices, will improve the use of drug therapies, and will improve obviously communication and education, not only of the employees but also of the employers. We want to help dairy producers to become better coaches for the employees, and we want to help vets and other professionals to become on-farm science teachers. So with this, I would like to acknowledge all the persons that have been involved in our project. They are listed here, probably I forgot many. All the institutions and the USDA for funding our project. With that, I'll take any questions. Thank you.
Thank you.